Hi there, fellow nursing educators. I know statistics aren't everyone's favorite part of teaching, but understanding reliability can really boost your confidence in your assessments. So let's start with what reliability is. I want you to think of reliability as your exam's consistency and dependability. It's like a trustworthy friend of assessment statistics. In simple terms, reliability answers the question, if our students took the same exam again without studying more or remembering the questions, would they get a similar score? A reliable exam gives consistent results each time. Now, we typically measure reliability using something called Kronbach's alpha coefficient. Don't worry about the formula. Just know that it gives us a number between 0 and 1, where higher is better. So let's make these numbers meaningful. If you get a score of 0.9 to 1, this is incredibly excellent reliability. This is like a gold standard exam. When your test shows a reliability of 0.96, like the example, you can feel very confident that it's consistently measuring what you want it to measure. Now, 0.80 to 0.89, that's good reliability. Now, but keep in mind, a subcategory with 0.87 reliability is still also performing quite well. Now, 0.7 to 0.79, that's acceptable reliability. When you see a subcategory of your exam at 0.7, it's doing an adequate job, but there might be some room for improvement. Now, if it's below 0.7, this suggests the questions in this section might not be working together consistently to measure the same concept. Now remember, it's completely normal for subcategories to have lower reliability than the total test. That's because reliability tends to increase with more questions, so don't worry if your subcategories aren't all in the excellent range. Now, for high reliability sections above 0.8, you need to celebrate. This tells you these questions are working well together. And I want you to be sure to consider what makes these sections strong when you're writing future questions. For the sections with lower reliability, around 0.70, look for ways that you can improve. Ask yourself these questions. Are the questions clear and unambiguous? Do they all relate to the same core concept? Are there enough questions in this section? Remember, reliability isn't about making questions easier or harder. It's about making sure they consistently measure what you want them to measure. Now, the next time you see reliability statistics, I hope you'll feel a bit more comfortable interpreting them. You're doing important work evaluating your students' knowledge, and in understanding reliability, this will help you ensure your assessments are fair and meaningful. Your students are lucky to have a faculty member who cares enough to explore these concepts.